Hello, Carolyn. Thanks for joining us. We're keen to find out what is the lay of the land within healthcare services within our region, and this comes at a very timely moment to have this conversation with you, because obviously in the last week things have escalated a little bit in the Nepean region, and we're asking these things because we want to know how best to pray, amongst other things. To begin with, can I ask you about your area of work, which is alongside supporting volunteers within the healthcare system? Where are things at the moment?
Look, thanks, Graham. So I specifically work with volunteers in supportive and palliative care in the local health district. So it's a bit of a smaller group of volunteers. There's larger groups in each of the hospitals, particularly of general volunteers who go to the hospital. We call them the red shirts in Nepean Hospital, and just provide whatever care and support patients, visitors need. If you've been to Nepean Hospital, there's a guide desk at the front door. So sadly, as of the lockdown on the 28th of June, it was decided to stand down all of the volunteers, particularly in inpatient settings. Once again, this happened for an extended period last year as well. And I think all the services were still getting back up and going from that lockdown. And in supportive and palliative care, I still had a number of volunteers who were supporting, their clients who were at home in the community or in the hospital. But as of this week, due to the escalating situation in our local health district, which we really haven't faced before, all volunteer activity is now shut down. So, and this has been really difficult. It's difficult for the volunteers, and for the clients that they've been supporting. They're much more isolated than they were before. And
difficult for staff as well, because it would add a huge extra burden upon them.
Well, exactly. I mean, the priority of the local health district at the moment is to keep their staff well and protected from COVID. So there is now no more visiting at all in the hospital and inpatient settings. And this is to try and stop the spread of COVID from anybody coming in. But also, I think, volunteers just loiter with intent is how I describe it. So they're very much, can just provide that background support, particularly to sit and chat to people who are a bit anxious, would like someone to talk to, while the medical staff, nursing, medical, can just focus on, that clinical care. And certainly in supportive and palliative care, that's what the staff are now also needing to do as people are isolated from their family and loved ones, to just try and provide that comfort and care as well. So, that's a kind of double burden on them, certainly.
More broadly, we've heard of the outbreak of COVID in the mental health ward at Nepean. I'm imagining that this has added significantly to stress amongst staff everywhere. What's it been like for staff at the moment?
Look, it would seem, I think people are much more concerned. As I said, this is really the first time we've had to face, as a local health district, the reality of it in our space. And I think people as health service have been very aware of things like Southwestern Sydney. One of the palliative care volunteers is also a staff member at Liverpool Hospital. So kind of hearing those stories, but not really having to think about that in our space, and knowing how fortunate, we've been. I think people are certainly getting vaccinated at a much higher rate, which is absolutely fantastic. And, looking to protect themselves and their loved ones from that perspective. It would seem that the management's been quite proactive about being in touch. We're getting COVID updates every single day. as of yesterday, any staff person with a clinical contact now has to wear the P95 masks and a face shield. Let me tell you, the P95s are very uncomfortable, I found out yesterday. And all of the community nurses are now wearing full, what we call PPE, personal protective equipment. So masks, goggles, gloves and gowns. But needless to say, they're trying to also minimise contact, and that's a really difficult balance to have with, providing care but also trying to protect people as well. Very difficult balance, I think, to try and maintain.
Just coming back to the subject of palliative care, we understand, correct me if I'm wrong, but we understand there actually aren't any dedicated palliative care beds in the Nepean Hospital, and that seems extraordinary to me. Is there anything we can do about advocating for a change in that? We know there's a few beds available here in the mountains, in Springwood and Katoomba, but to be nothing dedicated in the new development of Nepean seems beyond belief.
Look, it's historically it's because we used to be one area health service, and the palliative care unit that was built for the area health service is at Mount Druitt. It's a lovely separate space with gardens and a big veranda. When we split into two local health districts, so Western Sydney Local Health and Nepean Blue Mountains Local Health, then there just wasn't, there wasn't a space here dedicated for end-of-life care. Now is the time to be thinking about that because of all the redevelopment. But at the moment, there are no concrete plans in stage one, which is that big building that's already been built and will be opened next year, neither in stage two, which is kind of another building on the side, for a designated palliative care ward. Now, that's just not beds. That's actually a whole space that's more home-like, that all of the staff there are trained and specifically working in end-of-life care, that you have all of the OT and physio and pastoral care and social work all also working with people around that end-of-life care, and a whole group of volunteers, and that, people can have their dog come in to say goodbye and their grandchildren, and there can be family barbecues. So it really is a good time to be bringing community awareness to the CE and the board of the local health district about the need for this. There is a petition at the moment. I can certainly pass the link on to New South Wales Parliament around this, coming out of a very unfortunate experience that a family had in June in Nepean Hospital. I guess just talking, to particularly Stuart Ayres down in Nepean, Susan Templeman and Trish Doyle are really on board with the need for this. But it is, I guess, a Nepean issue in that sense. So just bringing that to people's awareness. Often people don't realise, because if you haven't ever had an experience in a palliative care ward or unit, then you just have the experience that you have, and look, the staff try to do their best. But essentially, even the beds in Blue Mountains and Springwood, it's a general medical space that people are dying in, and look, we can do better. We can absolutely do better.
We must do better. Yeah, Carolyn, just to finish with, are there specific issues that we could and should be committing to prayer at the moment in this whole area of healthcare?
Yeah. Look, certainly I think for staff, looking after people who, have COVID at the moment, HIF, Hospital in the Home, are actually looking after, I'm just looking at the 180 people, and that's going up by at least 25 per day. So that they're just really, for compassion, for the skills that are needed, particularly in multicultural households. And, you know, they're just that they stay well in mind, body and soul themselves as staff, and can provide the best care that they can. I think that, you know, the people making the decisions and that very tricky balance between, you know, the safety of all, but also, again, those emotional, you know, spiritual needs of people, you know, as they're in hospital, they're afraid, you know, they're concerned, and just that, you know, they can really, you know, make good decisions around balancing all of those aspects for people. Yeah, I think prayers around all of those, and also that, you know, that information can be shared that is really helpful for people in the community, that can allay fears, but also help them understand what they can best do for themselves and their loved ones, and share that information. Yeah, that would be.
Thank you, Carolyn. Appreciate your time. We're aware it's a time of raised anxieties for everybody, but it's especially important, I think, that all those working in the healthcare world are supported and encouraged, because we are all more than ever reliant upon them. So thanks for your time.